Taking all the precautions they can, medics help administer tests for corona contamination. At this centre in Berlin, Dr. Ulrike Lipke and her team are showing concerned patients how to perform the procedure on themselves outdoors. When it's done, their swabs and blood samples are sent for analysis.
We explain and deal with people's uncertainties, including their everyday problems, worries about chronic illnesses in connection with the coronavirus. By doing so, we are taking away some of the burden from emergency ambulances, and that's our job.
The size of the task Germany faces is clear, with tens of thousands of confirmed cases and the worry there may be many more as yet undiagnosed.
Ärzte und Pflegekräfte und alle
Doctors and nurses working in the medical profession are preparing for the biggest challenge in 75 years. We already have many infected people in Germany and we are reporting many deaths. But that's still the calm before the storm. No one can say exactly what is coming in the next week.
So far, only a few hundred people have died as a direct result of coronavirus in Germany, in stark contrast to several of its European neighbours, which has led some people to ask how there can be such a discrepancy.
The reason for Germany's relatively low death rate compared to the number of infected people can be explained with the high number of tests in Germany. Estimations coming in over the last couple days are that we conduct about 500,000 tests every week across the country.
Another factor which helps explain the low death rate is how prepared the healthcare system is generally. Germany has many hundreds of thousands of hospital beds, of which around 25,000 are intensive care unit beds. The military is also making its facilities available to increase capacity. There are also tens of thousands of ventilators in place and orders for many more, meaning hospitals have so far faced no mass influx of infected patients at the same time as happened elsewhere in Europe. And then there's the breakdown of the cases themselves. The testing being performed at centres like this one here in Berlin and around Germany show that 54% of those infected so far have been male, 46% female. The average age of the people dying from coronavirus in Germany is 81 years old. The average age of those infected so far is 46 years old. Which is because many of the first cases here were of younger people who contracted the virus while on ski trips to Italy and Austria. Leading scientists say as more patients do succumb to the condition, it's very likely many more younger people will be amongst those who die. Dominic, Kane, Al Jazeera, Berlin.